From expectations to conversations, we offer all the services you would expect. HealhFirst Network provides quality, confidential reproductive health care, education, and nutrition counseling.
Karen Zimmerman, a WIC specialist from HealhFirst Networks. Talking WIC, this is the third time we've had a chance to talk on these podcasts, which is great. This time, let's focus on breastfeeding. How does WIC and breastfeeding go hand in hand? Because it doesn't seem like they would be in conjunction with each other.
So how we feed our baby is one of the main components of what the WIC program is. Breastfeeding is the gold standard for how we should feed our babies. Now, a lot of moms haven't had very much support in their own histories and own lives to be successful at that, even if that is what they want to do, because none of their people that they associate with have ever done that. One of the things that the WIC program has is called a breastfeeding peer program.
Oh.
And what that is we have moms who have breastfed their own children and have been involved in the WIC program. They connect with our new moms to be their support person.
Oh, that's cool.
One of the aspects of it as a peer is that they need to speak the same language and be of the same culture as the moms. So in our population, we have like 30% of our population is Hmong. So we have a Hmong woman who has breastfed her babies that can speak Hmong, that can call those moms and chat or be that support person for them to call back to. And how it works, the moms are connected via text or phone call, and we just reach out to them and say, hey, here I am. If you have troubles, if you have questions, I'm here to help you.
Is there a typical question?
It all depends on the mom's situation. If there's no problems, then you talk about what to expect and what's normal baby behavior in the beginning. But if there are troubles or the mom just has questions like, is this normal? Or is my baby getting enough to eat? Doesn't seem like he's growing good enough. Or how do I breastfeed my baby when I have a 2-year-old that's also running around ripping the house apart?
Right.
So those kind of just mom kind of conversations and support is what the program is all about.
Is there such a thing as breastfeeding classes?
Oh, yes. Yes, most definitely. That's another aspect of our program, that we offer moms a breastfeeding class that is available to them in the last month or two before they are scheduled to deliver their babies.
Okay.
And things that we talk about in that class, we cover things like, what are the benefits of breastfeeding? How do you get started? What can you expect from a normal, healthy baby in the beginning? What's normal newborn behavior? And as a new mom, how do I know if my baby's okay? Mm-hmm. And what can I expect the baby to do or not do? And then if these symptoms show or this behavior shows, then that's worth a call to reach out to somebody. It really helps moms be prepared so they're confident going into having this baby, whether they're breastfeeding or decide after they get going that maybe that it isn't working so well. But they have the ammunition then to do an informed decision about what and how they feed their baby going forward.
So is there any certification the staff has to go through?
Yes. All of the counselors for the WIC program are certified to some level of breastfeeding certifications. And there's varying levels of that. All of the counselors have had additional training on breastfeeding and be certified. And one of our breastfeeding counselors is in the process of becoming an IBC LC, Certified Lactation Specialist. And that stands for International Board of Certified Lactation Consultants. And that's the highest level. It's a certification that's geared towards medical care professionals who undertake the clinical management of breastfeeding in support and education. So for those moms that are having more difficulties, she will be able to help them in a very specific way because of all this extra training that she's had. And the test is quite involved. One of the goals with having her at this certification level, besides being that extra asset and resource for all of us and our WIC population is that we'd like to open that up to the general population so that we can serve as a resource for that within our community. The local healthcare systems have very limited numbers of this level certification within the hospital and primary care systems in our communities. And so we've identified that as a lack, and we're trying to fill that void with this certification here.
So, Karen, it seems to me that HealhFirst Networks wants families and moms and babies to be successful, and that's why you guys are helping a staff member get through and get certified as IBC LC. It seems like you guys are working toward something that a lot of other people are pushing away.
Yeah, I guess we really saw that there was a void in our community. So supporting our staff member to become an IBC LC, we feel that this is just a way for us to support moms in a more complete way, better resources for our moms to be successful at breastfeeding.
For more information, visit www.healthfirstnetwork.org or find us on social media at HealthFirst Network, Inc.